Okay. Hi, Dr. Cooper. How are you?
I'm doing fine, thanks.
Well, thank you for coming on the show. I appreciate it. So, you've got a book out. Your book is called Why Are Health Disparities Everyone's Problem? Is that correct?
That's right.
Okay. So, I'm a little bit confused. Maybe you can clarify this. Is it health disparities or health care disparities that we're talking about?
We're talking about both, but I said health disparities because I think health is about all of it and healthcare is one part of it.
Okay. Well, why don't we cover both aspects of that then to give people a better understanding? So the book title is Why Are Health Disparities Everyone's Problem? Now, when you're talking about health disparities, you mean what? Some people are healthy, some people are sick? Is it as simple as that?
Well, it does. I mean, but it's really kind of systematic differences in health and opportunities between people with different levels of power or privilege within a society. And they're really avoidable differences.
Can you give me an example?
So, we have in this country, we have infant mortality rates, and that means the death of a child before their first birthday that are 2 to 3 times higher in African American and Native American women when compared to white women. There's really no good reason for that in this country where we have, uh, you know, opportunities for people to get prenatal care and to get whatever they need to have a healthy pregnancy and to have a baby that actually lives through the first year and lives to be an adult. So that's completely avoidable.
Is there any particular reason for that other than perhaps financial?
Well, yeah, I think there are lots of reasons for it. Financial may be part of it, but I think um, there have been centuries of kind of unjust treatment of people in different groups in our country. So people have lived in neighborhoods that have fewer opportunities for them to be healthy. They get exposed to more harmful environments, toxins, exposures. They don't have opportunities to eat healthy or to exercise on a regular basis. They don't have opportunities to get a good education and get a job that pays a good living wage. And then they don't have access to healthcare. And so when you have that going on, it's not a surprise that people can't be healthy and that we have higher obesity rates and more diabetes and heart disease and cancer in communities of color, as well as in communities where there's lower income compared to sort of more advantaged communities.
Well, I know from personal experience that I've tried to lose weight for many, many years, and eating healthy is far more expensive than eating junk. And I think that's a problem for people that are on EBT or food assistance. You're going to try to maximize your food dollar, and buying junk food, you can get a lot more of it. I mean, I know this just from experience.
Yeah, I mean, absolutely. It doesn't make sense that, it's cheaper to buy a bag of potato chips or a hamburger than it is to get some fruit, or to eat a salad.
No, it's very true. And so I understand when I hear news reports and things that people say that obesity is a big problem amongst lower income people.
I know. So it's not only about people making bad choices, it's about them not even having the opportunity, right, to make a good choice. The incentives are in the wrong direction, right?
Well, I think so, yeah. Let's talk a little bit about health care. Now, there's been a lot of talk about universal health care in this country, socialized medicine, whatever you want to call it. Are we doing poorly in the United States, do you think, compared to Europe or other countries around the world in terms of providing equal health care to all of our citizens?
Yeah, I think we're certainly not doing as well as many of our European counterparts and even our neighbors in Canada, for example, with regard to just providing basic access to healthcare for the majority of our citizens. I think we've done a better job since we passed the Affordable Care Act and since Medicaid has been expanded, and now more people have some access to health insurance and to primary care. But there are still a lot of people in our country that have no health insurance, or that have insurance that won't cover, some basic prevention things that they need, or some medications that they might need.
Okay. What are you covering in your book? Can you give us some examples of what is this something that somebody could buy who may be having these difficulties with healthcare or with their health in general, and your book can provide some guidance for them?
Sure. I think the book provides some good practical tips for anybody, really. It talks about the problem of health disparities in our country and how it came to be and where we are now. It gives some really specific examples of what it looks like and why, someone who lives in a neighborhood just 5 miles away from another neighborhood might actually end up living 20 years less than the person who lives in a more advantaged neighborhood. It talks about basically what happens in doctor-patient relationships and how people who have less education might have to learn more about how to ask the right questions and how to get more involved in their care and how they can speak up for themselves, when they're dealing with the healthcare system. It also talks about how people can get involved in their communities and working within their churches or their schools or other organizations they're in to advocate better for better support from government agencies and from leaders like policymakers to improve the health of their neighborhoods. So it gives a lot of practical tips, and even how people who don't come from those communities, people who come from more advantaged communities, can get involved and why they should care, because truthfully, inequities drive up costs for our healthcare system. They drive up our taxes. They make all of us unhealthier. Our country overall doesn't have the same level of quality of life as people who live in countries that have more equity. Our teenagers get pregnant at higher rates. We have higher obesity rates. Our kids don't do as well in school on science and math. And, we have just a lot more problems. And as you've seen, we're doing well relative to the rest of the world with regard to vaccines right now. But during COVID, our infection rates and our deaths are really high relative to our population compared to many other countries.
Do you think that we need a complete overhaul of our healthcare system in this country, or do we need to just sort of symptomatically fix it?
Well, there are a lot of good things about our healthcare system. We do have a lot of technology. We have a lot of well-trained health professionals. We have access to the, cutting edge new medications and new equipment and things like that. So there are some things that we should definitely keep. The other things that don't work as well is because we haven't invested in them. We should invest more in primary care, so doctors that basically help people stay healthy, make sure they get their mammograms and their flu shots and their pap smears and, the screening tests like the colonoscopy for people age 45 and older, those kinds of things. We need to invest in public health. Like if we had more contact tracers, we could have prevented the spread of COVID better. So we end up investing in a lot of expensive technology, which is not a bad thing to have, but it doesn't keep people healthy. It waits until people get sick and then we give them like everything. But we could really prevent a lot of people from getting sick in the first place if we invested, better upfront in the prevention side of things and in the primary care side.
Are you working at a hospital, or do you have a private practice, or both?
So I don't have a private practice. I work as part of, I'm a medical school faculty member, and then I work in a community-based clinic that is it's a federally qualified community health center. And I oversee the residents, the internal medicine residents who see patients at that clinic.
What would be your assessment of that particular clinic in terms of the number one problem that you should be addressed?
Well, we see a lot of people with common conditions like hypertension, diabetes, heart disease, asthma. We see a lot of people with obesity. I think our clinic does a great job because we specifically care for people from underserved communities. And so the doctors there are very committed. We have staff members that come from that community that also understand the problems pretty well. One of the challenges we have, though, is that clinics in underserved communities tend to have less money and less resources to hire more staff. And so we don't have all of the same facilities and access to all of the same sort of, staff members and cutting edge technologies as some of the private hospitals. But we do know how to take care of people from underserved communities. And so I think we do a really good job with what we have, but we could certainly use more. And I'm glad that the federal government, for example, in some of its new funding is actually putting money towards community health centers and helping them to develop, like, for example, better computer systems and helping them to use their the funding to hire and train more staff that can do outreach and that can really support patients who have a lot of social needs.
Was there anything else you wanted to bring up before we wind it down?
Just that I think that everyone has a role to play, whether you work in healthcare or in another field, in looking at your own organization and how it treats people and how much it prioritizes health for everyone. Also remembering that being civically involved is important and voting for people who care about things like access to opportunities for everyone. And finally, just remembering that it's not a zero-sum game. Because we invest in health equity doesn't mean that anybody loses out. It just means that we all improve, but we all get what we need. And not everyone needs the same thing. If you're somebody who has a great job and has great private insurance, then maybe you don't need a special care manager program, but maybe if you're not from that background, you might need more.
Okay. Do you have your book to hold up?
I do. I do. It's right here. Why are health disparities everyone's problem? And on the cover, there's Lady Justice on there, balancing the human heart.
Hold it up a little higher so we
Basically,
can.
health is
There we go.
what makes us all able to enjoy a good quality of life, and everyone deserves to be healthy.
Well, I agree with you. I think that healthcare should be, I think it's a human right, especially in this country, where we do have the resources. I suppose it's
We
just.
do. It's not as
yeah.
if we can't, afford it like some other countries. So we should do our part here, and we should do our part around the world. So we should help other people get vaccinated, and it'll keep us all safer too.
Last question, and then we'll wind it up. Do you have a website that you want to give out?
Sure. It's called healthequityhub.com. healthequityhub.com. That's the website for Johns Hopkins Center for Health Equity, where I do all my work. That's a center I direct and that I founded. And you can find information about the book there and also on Amazon.
Okay, great. Well, Dr. Cooper, thank you so much for coming on the show. It was nice meeting you and nice talking to you. Best of luck